A popular asthma inhaler is being pulled from the market. Drug company GSK is discontinuing its Flovent inhaler. There will now be a generic version in its place, and experts warn there could be some problems with that. Joining us in the new year for the first time, Dr. Jeff Pothof. Not the first time you've been on our show, first time in 2024. You are UW Health Chief Quality Officer. Doctor, great to see you. Flovent, let's talk about it because so many people get prescribed that with the inhaler. What's going on there?
Yeah, so Flovent is an inhaled medication that people with asthma take, and what's happening is the manufacturer is switching it from a brand name to a generic. So the medication will be available, but insurance companies need to update their formularies so that when patients go and fill this medication in January, it's covered under the generic and isn't kicked back as, an out of formulary medication, in which case you could, see a couple $100s in a bill. So if you are on Flovent, the important thing is to contact your insurance company now, your pharmacy benefit, and say, hey, when I run out, is it going to be covered? Are you going to switch to alternative? What's going on? So you don't have a surprise bill when you fill your inhaler in a couple weeks.
Yeah, a lot of people not familiar with how the system works. I still have no idea how the system works after, all these years. But you may just get that surprise bill if you're on Flovent, right? Not realizing maybe your insurance company doesn't cover this anymore. It's under this new name.
Right. So if the insurance company doesn't switch it over, it'll look as if you just, got a prescription for something that's out of formulary. I think ultimately your insurance company will come around to it. It'll get paid. But if you find yourself with a new bill for your Flovent, question that. That ain't right. More than likely, this will be covered underneath your insurance once they get all their records up to date.
Yeah, make sure they sort it out for you. Hey, if your kid has peanut allergies, there's promising new news out about a new treatment that may give him some relief.
This is interesting. It's a medication called Xolair. It's been used for asthma and chronic hives. It's got a very good safety profile. And what they're trying to understand is if we administer this, especially to children, can we reduce the incidence of those severe anaphylactic food allergies when kids come in contact with, unknown peanuts in something or a whiff of peanut smell. The data is looking promising. It looks like it takes a much higher dose to kick off those very severe allergic reactions. I think we need to see the full study here. There's probably more work to be done, but for parents who have kids with those severe allergies, this is something to potentially look forward to in the future as a way to decrease those severe anaphylactic reactions.
I know a lot of families struggle with that with the peanut allergies. Let's talk RSV for a second here. There's a new study out saying, out of flu, COVID, and RSV, it's RSV that's most likely to send your kids to the hospital.
Yeah, this one was a bit of a surprise. Now, it comes out of Sweden, and their numbers are probably not the same as we'd see in the United States, but they saw for, kids that got admitted to the hospital, RSV had an 80% admission rate versus influenza and COVID, which were somewhere in the 30 and 28% range. And I think, what it really does is shows that RSV can be a big deal in young kids. Sometimes we don't give it credit for how good it is at getting our kids sick. And I think, the take-home message is, we need to do what we need to do to keep our kids safe, whether that's vaccinations or immunoglobulins for those very young kids, cover our coughs, stay home when we're sick. All of these pathogens, RSV, COVID, and influenza, will cause some kids to get pretty sick.
Dr. Jeff Pothof, thanks for starting to keep us healthy in the new year. Appreciate it.
You bet.